I am a physician and a social entrepreneur, and I'm most passionate about advancing or actually transforming health and well-being radically and globally for all, and about doing so through what I call catalytic boundary crossing thinking and action. And why? Because health is not just a biomedical issue, it actually is strongly eco-socially determined and influenced. So if we want to achieve true health, that means going beyond the mere absence of disease to achieve optimal physical and mental and social well-being. We really are we and our circumstances, because we don't live in isolation. So who we are, our health and our lives are inextricably linked to others, to our communities and environment, and ultimately the world around us. It turns out that this world of ours in the 21st century is facing some formidable, urgent global challenges. First, the world population is growing at a very fast pace and with an unprecedented urban concentration. By 2050, will be 9 billion people living in a small world with limited resources and a 70% urban concentration, many of us in mega cities. On top of this, we're living longer, so the population around the globe is aging. Modern demographics and these modern lifestyles that I've just talked about are actually key drivers of one of the biggest health threats of our time, and that is the rising wave of the chronic disease or non-communicable disease epidemic. Cancers, Alzheimer's disease, other neurological and then mental disorders, cardiovascular disease, and silent risk factors such as hypertension or obesity or diabetes are disabling and killing hundreds of millions of people, not only in our modern developed countries and world, but actually more so in the developing world, where most of the global population concentrates and where they are actually living under more vulnerable circumstances already. Our third challenge is that there is a growing socioeconomic disparity and gap in access to quality healthcare, education, and technology across genders and races and borders all around the globe. Then we have our current infrastructures and cities and systems that are poorly adaptive and non-resilient, and limited resources which we are managing in inefficient, linear, wasteful ways. So we are doing things in unfit ways to meet the increasing needs and demands of the global population, and also in ways in which we are unprepared to deal with the geopolitical, social, and big climate environmental changes that are happening at an overwhelming pace. We're practicing a kind of medicine that is reactive and episodic, mostly managing symptoms when problems arise rather than being proactive and preventive and actually curative. Our ways of dealing or providing healthcare are also fragmented. We see different specialists for different problems instead of integrating the information that we have available to treat the body and the mind and people and their lives as a whole. We are also still based on a biomedical and pharmacological system rather than incorporating the eco-social factors that I've mentioned before. Altogether, this has caused a healthcare system that is highly inefficient and high cost, and therefore non-universally affordable or accessible for most people around the world. We could see these challenges as a daunting mountain, or as I prefer, we could think about this being a formidable opportunity to rise up to new horizons and to really advance and transform the way we live our lives. How do we solve these challenges? The first thing that we need to realize is that they affect us both as individuals and as a whole society. Nobody can escape from them. The second thing, as I've mentioned, is that they're multifaceted and complex. They have many different dimensions, and actually often they're interconnected. And the third thing, and I think this is quite important, is to realize that these challenges are sort of invisible to us on an immediate day basis. But actually their impact it's present, it's slow but sure, and it's large scale throughout time. So if we want to solve these multifaceted and broadly reaching challenges, we need to do things in a different and more integrated and real world way. First of all, we need to proceed through what I call catalytic bonding. And this means that we're going to have to get together in strategic partnerships, not only different minds and hands across disciplines, but also different kind of stakeholders when it comes to our health and well-being, and they must be able to work together. And we have to catalyze their minds and hands to produce what I call best ideas that are actually experiential and that lead to transformative action. Why is this important? Well, because we human beings learn best through our own experiences, and things have to be transformative because only in that way the change can be sustained and maintained over the long term. But actually, there is one more element that needs to take place besides the catalytic bonding, and that is the will to change. People have an intrinsic resistance to change, and changing takes an effort that ultimately needs to be supported by society. Otherwise, it's never scalable and sustained and maintained for the long term. So these are two key elements that our solutions must incorporate. The next question is, in our case, how can we harness the power of the incredible medical, scientific, and technological advances that we've made so far and that we will continue to make through catalytic bonding, so that we can advance our health and ultimately our lives? Because right now, for instance, in medicine, we have the incredible power of gene editing to think about curing diseases that were incurable before, or the power of regenerative medicine, immunotherapy to fight against cancer, nanotechnologies to take us to places where we couldn't even get before and really aim at eradicating diseases. And also, thanks to the information technology and digital revolution, we have now big data availability and the capability to analyze it that is unprecedented in speed and power. So how can we integrate that powerful information to first understand what normal means in terms of our health and what normal is in terms of being human, so that we can then detect early signals so that we can act in efficient and real-time ways when it comes to detection, diagnosis, and treatment of diseases. The second thing is, how can we put the power of this information in the hands of the actual end users, the patients and the individuals who have very specific personalized needs and needs that change through their lifetime, so that they can take care of themselves and make the right kind of healthy decisions at the right time. And finally, how can we seamlessly integrate this into their everyday life so that, as we spoke before, we practice a new way of caring for people that is truly eco-social? In the end, I think we should aspire to create a new healthcare model that is powered by what I call a five-pronged superplug that allows us to practice a medicine that is preventive, predictive, pro-adaptive, personalized, and participatory. These are some glimpses of the individual and social health vision we can achieve by accelerating the boundary-crossing actions of lively hands and lively minds in medicine, science, technology, and eco-social development together to cure disease, but ultimately to move forward and advance the status quo of our society, sustainably transforming health and well-being for the long term and for all. Thank you.